I'm Rob Fox, and I'm an orthopedic surgeon and specialize in the foot and ankle. One of the things we'd like to talk about today is really determining what type of foot you have and how you go about doing that. In a prior video, we talked about the foot being divided into three different types, types 1, 2, and 3. And a type 1 foot is a foot that is overpronated or hyperpronated, also called a flat foot or a pronated foot. And a type 1 foot is how we like to refer to it, so it encompasses all of those things. The type 1 foot, again, is the one that is pronated with the foot turned towards the outside. And the way that you can determine whether or not you have a pronated foot is for you to be able to find a place where you have cement, where you can see wet footprints, get your foot wet, step in a bucket or in a puddle of water with your bare foot and walk across a cement surface. And what you will see when you do that, if you have a type 1 foot, is that your foot will show much of the footprint. It'll actually have almost the entire foot outlined, and you'll be able to see almost part of the arch showing up on that wet footprint. And that tells you that you have a type 1 foot. In addition, a type 1 foot also has a different wear pattern on a shoe than other foot types. Usually somebody who has a pronated foot will tend to wear the shoe in a couple of different places. More often, they will wear the shoe a little bit towards the inside of the heel, so towards the middle. In addition, a type 1 foot tends to have more stress on the inside of the arch, so the inside of the arch over here, and along the inside of the ankle. So if that seems to be where your foot tends to fatigue or feel tired, that may indicate that you have a type 1 foot. A type 3 foot, which is the opposite of a flat foot, more of a high arch or cavovarus foot or cavus foot, and that's in some terms is called a pes cavus foot. That foot tends to be turned in so that the heel is actually turned towards the middle of your body. If you have this foot, you'll be somebody who thinks or have been told that you have a very high arch. And what you can see with the wet cement test is that when you get your foot wet and walk on wet cement, you're going to see a very minimal footprint. You'll see the heel and you'll see the ball of the foot and maybe a little bit along the outside edge of the footprint, but you won't see the whole footprint in a flat sort of complete way. And that can tell you that you have a type 3 foot. In addition, a type 3 foot or a cavovarus foot will tend to wear the shoe on the outside of the heel. So you make contact on the outside of the heel, which is back, if I show you the back of the foot, the outside edge toward the outside rather than the midline of your body, that's going to wear out really quickly. And then the outside of the shoe will wear all along that outside edge and won't wear nearly as much along the inside of the front or the back of the foot. So it tends to wear that outside of the shoe down. In addition, a high arched foot tends to have more stress along the outside of the foot. So you'll feel more fatigue or more tiredness along the outside edge of your foot, and you may have pain along the outside middle part of your foot or that bump that's on the middle part. And you can have more frequently ankle sprains. So if you tend to sprain your ankle more often than others, it may indicate that you've got a high arched foot as well. Now a type 2 foot, that's kind of in between. That might be the more difficult one to determine. But if you don't fit the criteria that we've discussed for types 1 and type 2 and type 3, you may be a type 2 foot with a more neutral arch. You can still have an ankle sprain occasionally, but not as often. And usually you're going to see with the wet footprint test, you're going to see something in between. You'll be able to see the heel, you'll see the ball of the foot, and you'll see a little bit of the middle part of the foot, but it's going to be somewhere transitioning between that high arch and that flat foot deformity.